Hi, I'm Moriyama, and we are from the Queen's Square MSc in Clinical Neurology. We have prepared a video about how to communicate with patients during a neurological examination. We hope you will enjoy it.
Hi, my name's Tom. I'd like to examine you if that's all right.
Sure.
Okay, I'd like to do things like test the strength in your muscles, tap your reflexes, and ask you to remember and memorize a few words.
That's okay. Let's do it.
If you have any pain anywhere, or if you want me to stop at any time, just say so.
Okay.
I'd like to take a look at your walking in balance now. Is that okay?
Yes, it is.
Now, can you stand with your feet together, put your hands by your side, and keep your eyes closed? Do you feel steady enough to walk from one end of the room to the other without my help?
Yes, I do.
Now I'd like you to stand with one foot in front of the other, your heel touching your toe. That's good. Now can you walk like that as though you were walking a tightrope? Now I'm going to test how stable you are on your feet. I'm going to stand behind you and I'm going to pull you back by your shoulders, a bit stronger than this. Don't worry, I'm here to catch you and you can take a few steps back if you want. Now, keeping your head still, I'd like you to look at either my fist or my finger. When I say fist, look at my fist. And when I say finger, look at my finger. Do you understand?
Mm-hmm.
Okay. Fist, finger, fist, finger. Can you clench your teeth? Can you frown for me? Raise your eyebrows, please. Now close your eyes tightly and don't let me open them. Puff out your cheeks and try not to let the air out. Show me your teeth. Can you pout your lips? Open your mouth and say ah. Can you shrug your shoulders? Now turn your head to the left and push against my hand. I'd like to test now how well you can feel this pin. It's quite sharp, but it won't hurt. See? Now tell me if you can feel this as sharp.
It's sharp.
Now I'm going to use this tuning fork. Tell me if you can feel it buzzing.
Yes, it's buzzing.
So now we'll test the strength in your arms and your legs. Could you put your hands out in front of you with the palms facing upwards, close your eyes, and leave your hands where they are. Now, raise your arms to the side as though they were wings, and try not to let me push them down. Now push me down. Now put your arms in front of you like a boxer, and don't let me pull you away. Now push me away. Now put your arms out in front of you and cock your wrists back and don't let me push them down. Now keep your fingers straight and don't let me bend them. Now spread your fingers out, keep them spread out and don't let me push them back together. Now make a fist and try and keep it closed while I try and open it. Now I'd like you to lift your leg up off the bed and try not to let me push it down. Now try and push my hand into the bed. Now bring your knee up and try and pull your foot towards your bottom while I pull in the other direction. Now push me away. Now push your foot down as though you were pressing on the accelerator. Now bend your foot the other way so that your toes are pointing towards you. Try and resist me while I push your big toe down. Now I'm going to tap the reflexes in different parts of your body, so stay relaxed. I'm going to run this stick up the sole of your foot. It's a bit sharp, and it may feel a bit uncomfortable, but it won't hurt. Using your index finger, I'd like you to touch my finger, and then touch your nose, and then bring it back to my finger. And keep going. Now I'd like you to lift this heel into the air and bring it down onto your knee, and then run it all the way down your shin. And do it again for me, please. I'd like you to copy the movements that I make with my hand. Try and make the movements as large and as fast as possible. Now tap your fingers. Now open and close your hands. And now spin your hands.